they've shown some pretty good studies where they've taken teams and put them through, it's a 6-week program, usually done pre-season, as you know, and in fact can reduce the rate of injuries almost down to the same as boys if you look at injury patterns over a couple of years.
And then when you do an ACL surgery, how do you repair an ACL?
Well, we do it now arthroscopically, so there are no big incisions like the old days, and we use one of the tendons, and most of the time of your own tendons or tissues, and make a new one. And basically what you do, and if you look at the model here, if you're using your own tissues, you take 2 of these hamstrings, which are little spaghetti tendons on the inside part of your knee. There's 4 of them over here you can steal, but we only really take 2. And then you take these out through a small incision on the front of the shin, and then you drill a hole in the bone from here to inside the bone here, and then you put another hole up in the bone here, and you basically put the graft that you have, that you've made into like 4 strands of spaghetti that are turned over on each other, and you put them inside the bone up in here with a screw or a pin, and then put another screw down here to hold it in place, and it replaces the ACL that you have. The other graft that is commonly used, has been used in the past, is your patellar tendon, although girls tend to have more trouble with their kneecaps in general, with kneecap pain problems, and so sometimes the problems with kneeling and kneecap pain after the surgery occurs. And then there's another kind of graft that if you have torn your ACL, you probably hear about, called an allograft. And an allograft is a cadaver tendon where you take it from a donor. And they work very, very well, but there is a risk of infectious disease transmission, and we really don't know the long-term effects of putting a cadaver tendon in someone's knee over 30 or 40 years. I've certainly got 20-year follow-up now on the ones I've done, and they continue to do well, but my preference personally is to use the patient's own tissues, if at all possible.